people aren't worried. I've had a lady in recently. It was actually a treatment that we're doing quite a lot more of, which I'm not sure I was seeing as many patients for it prior to the lockdown, but now it seems that I've seen a lot of patients recently. It's the treatment of the mons pubis,
Oh,
which is that sort of
interesting.
fatty
Yes.
area, yeah, sort of just
So
above,
just below the abdomen.
exactly. And I had quite a few patients say to me, we don't know anybody that treats this area. We're not sure that it's even a treatment that works or it's available. And why don't you tell people that you do it? And I said, I
Mm.
just hadn't even thought about it, but it was something that we were doing, but I hadn't really, advertised it or talked about it. And then I
Mm.
had a lady recently who she came to see me 4 times to be 100% sure that she was ready to go ahead with it.
Oh, bless her.
And it was because it had affected her life so much and
Mm.
every aspect of her life, and her confidence was that low because of it. And I just said, look,
Mm.
if you need to come back and see me, that's totally fine. At the end of the day, there's no pressure on you to have a treatment. And she's had her first treatment now, and she's absolutely fine. But it
Mm.
it took her 4 consultations before she could make that decision.
And what treatment did
Um,
you do?
it was CoolSculpting actually,
Okay,
because
yeah.
I think
So just freezing the fat
it's not
away.
for, exactly, it's not for every patient, and you
Mm.
definitely have to. It's a case by case basis, and I think you have to be able to be 100% certain that that person's suitable to have that area treated,
Mm.
because it's a very delicate place to be treating.
Mm.
But I've done a lot of CoolSculpting in that zone, and actually it works really well and is very effective and actually a very tolerable treatment. And I think it's just I'm not sure that many people talk about it because, again, as with a lot of women's health and women's procedures, it's a bit taboo and we don't mention it. So it's a shame, but I think that's something I hope will start to change more and more.